purchasing commercial property or residential in the DMV area, count on our ability to offer the best in the market. DMV, your American dream come alive with us. Come, let's talk at 1835 University Boulevard, number 314, Hyattsville, Maryland, 20783. Office phone number 301-326-1976. Office fax 301-328-0406. Phone number 301-222-7732.
Welcome to Moment of Truth. My name is Nadia Ashon, and of course, I'm talking from the studio. My co-host is...
I am David Tibodi, speaking from home.
Wonderful. And of course, she is talking from home. And our wonderful guest is Dr. Prince Danny, and he's going to introduce himself and then say a little bit about himself. And so, Doc, will you please introduce yourself to our guests, our viewers, and let everybody know who our guest is? Thank you.
Thank you so much, Mrs. Ashon. My name is Dr. Prince Jan from Ghana, obviously. Currently at Howard University Hospital, where I work as an internal medicine resident physician. I happen to also serve as one of the current chief resident physicians there now. I'm a family man with 3 kids and pretty busy, you can imagine that. And I really love to be on this show, to be an inspiration to anyone that will find our talk today very useful.
Thank you so much, Doctor. We really are excited to have you. And we just really want to just say thank you for taking your time out of your busy schedule to really be our guest. So we are talking today about career and how important career is in this event. Most times people know about their career way before they get to high school, and some people don't even know their career until they get to college. So we really want to take this opportunity for you to tell us a little bit, why did you choose the career in the medical field and what motivates you to be in that field?
That's a handful of questions. Actually, my desire to go into the medical field started with my mom. My mom works as a midwife, in a village in Ghana where, we were growing up. And so always seeing her deliver tons of babies and being the main sort of provider for the village and the whole community sort of, gave me a platform to like the medical profession. One other reason was also the fact that, being from a very strong Christian family with my dad, who happened to be the presiding elder in those times. Also, sort of every day as we had our morning devotions, they will go around and sort of mention to each of us individually and sort of prophesy on us what they will want us to be in future. So, they will go to each of us differently. And, some of my siblings, they did mention to them, you'll be the bank manager of the World Bank. And for some of us, they did mention to us that we will be, like a prominent physician, whose voice will be held worldwide, So with those proclamations, I found myself sort of growing up to meet those prophecies on my life. So those sort of words actually motivated me. And of course, growing up in a community where a lot of the people lack basic, healthcare needs, and then also a lot of people were, exposed to a lot of communicable diseases and non-communicable diseases. Also sort of gave me the zeal to be in the position to help. So all these things put together sort of motivated me to take upon myself the medical profession.
Wow, I am. It's just wonderful just to hear that. I think most people don't realize how influential our parents are in terms of our career. I think most young people will rebel against what we feel like is oppression, suppression, whatever it is. But you took it as a challenge. And that is what a parent want. A parent want to motivate you. And I'm so glad that your mom and your dad were the motivating factors that allow you to be in that profession. Do you also think that looking around you and just even as you talk about the community and everything like that, was it one particular person in the community, apart from your mom, that also shine a spotlight on the medical field as a whole? Because the medical field is really a big area. But was it specific somebody that was like your mentor or somebody that just really made the choice so much obvious to you when it comes to your job or your career field?
That's a great question. Most people, growing up sort of have mentors, people have gone ahead of them in their career field. But unlike in my situation, growing up in a community where I didn't have people who have even gone ahead of me, even to the university level. So obviously, I didn't have any of such mentors. The key person I saw as my mentor was my dad. My dad always told me that he had financial challenges, and so he wished he could have done better than how he was able to go the level that he attained. And so he always was a motivation to me. He always told me that the sky was less than my limit and I could do anything that I wanted to do in as much as I stay focused. So my dad was the key motivating factor for me. I didn't grow up meeting or having any doctors in my family or any close relations at all.
Thank you so much, Doctor. I just really appreciate that. David, do you have any follow-on question that you want to ask our doc?
Yeah, I'd like to ask what the journey was like for you. Like, how was the journey into becoming a doctor? Can you take us through the journey a little bit? So, childhood, you had motivation and all that. Then, what happened next? And what happened next? And how come now you're a doctor?
Great. So, for the medical professionals, we all know one must, go through the basic education, get to the college level, and you will complete your undergraduate training, which we call the pre-med, and then that will be for 4 years, and then you will move on to do additional 4 years of medical school. And then after that, depending on where, you train, you can either go on to work as a general practitioner before you start your specialization, program, which we call the residency program. So for me, in my case, I grew up in Ghana, did my med school in Ghana. And so, I happened to be fortunate enough to go to one of the best boys' schools in Ghana and, graduated and went to University of Ghana, Legon, where I went to the Premier University of Ghana Medical School. Among about 1,000 students who were competing to get to the medical school at that time. By God's grace, I happened to be the second highest grade point. So even though I came up from, a less privileged, community, but still I found myself, pushing myself towards my goal and towards my limits, what, I knew from my infancy, what my parents had told me, and which I also saw as my zeal, I worked towards that. And, being the second highest grade point, went to medical school interview and obviously, earned my spot out of about 75 candidates that were taken that year. And I went through my medical education at that time, finished that. And of course, knowing that, with the prophecy, I wanted to go on to be an international doctor. And so I happened to also have a very extensive exposure, visiting hospitals and having clinical rotations in, across Europe, Germany, and all that. And then also even that came to University of Michigan medical school to have some clinical rotations, and then sort of had a very good scope of the horizon. And then subsequently, moving on to Harvard, in Boston, where I had my postdoc fellowship, after medical school, and then subsequently, moving to Howard to have my residency training. So that is sort of in summary how the path has been. Wow. I mean, details of it has been quite challenging, but yeah.
Nothing good comes easy, so I'm glad to hear that. Wow, that's extensive. Over to you now.
Yes, that was really, I believe it talks about a journey. Most people realize that you didn't get to where you are right now without making those efforts. And I like the fact that the thread in this journey was the fact that there was a prophecy that was made. And as a Christian, we believe strongly that things doesn't happen by chance. And I love the fact that because of that prophecy, your journey has not been as smooth, but it has been constant. Like you constantly are working on that goal to be an international medical doctor. And here you are, graduating next month. And I am just so proud just to realize how much you put in to be where you are. And we are all benefiting from you being part of that dream. So thank you so much. So let's talk about just the areas, because you talk about your residency, your medical residency. What makes you choose the residency or the focal point that you are in your career right now?
Great. So after graduating from medical school, I mean, during medical school, you will have several rotations in several fields where you will have for child health, the pediatric field, you will go into OB-GYN, you do, the surgical specialties, and then you do what we call the general internal medicine, which sort of we call the actual physicians, So for me, I was drawn towards internal medicine because it's a specialty that I find it intellectually stimulating. I'm able to, add a lot of signs and symptoms. I mean, patient coming and telling me, okay, I'm having a headache here, I'm having this, and I'm having some weakness on this side, I'm able to come up with your diagnosis, not just because I want to go and operate on you, but, adding your physical complaints and your physical signs that you'll be presenting, I'm able to, come up with the diagnosis. And I feel that it's a specialty that I will be able to reach a larger population of people, no matter where they are. Like somebody can give me a call and I'll be able to know what is going on with them without necessarily having been, being with a patient to, let's say, go to the theater to operate, right? So I feel that it's a specialty that gives holistic care of the patient, and it sort of cuts across several specialties that takes care of the human being in totality. So that really made me to go towards the internal medicine specialty.
Thank you so much, Doc. I think that is important. Internal medicine is, we need internal medicine. And so I'm glad that you see the need for it and you are excited to be in that area. One of my co-hosts, Dr. Kumsi, is on the she's in Zoom. Dr. Kumsi, do you have a follow-on question? Oh, okay. So I'll ask my other co-host, David. Do you have a follow-on question just to ask our?
Yes. So I was thinking, he mentioned internal medicine. What other branches are there when you're looking into medicine? What other branches can people consider? Can he elaborate a little bit on that?
Sure. So so if you see a doctor is either going into operate or sort of not operate, right? So I'm just giving it like just the very basic summary of it. So whether the doctor is doing like surgical interventions, like it's always in the OR, having a lot of surgeries, or is a doctor that is doing non-surgical, sort of care for the patient. So the internal medicine physician sort of does all the medical care for the patient with very minimal, procedures. And that means that with that, we are taking care of you as an individual, from head to toe. So we have several areas of subspecializations. We have, the group of doctors that are taking care of your heart and everything that goes around with you, and that is like cardiologists. So that is also under my specialty. We also have the doctors who will take care of everything that has to do with your GI tract, from your mouth down through your intestines and your belly, what goes in there. And they will do all the colonoscopy for all these colon cancer screening and things like that. And when, people are vomiting blood and dealing with things like that, that is the gastroenterologist. And that is also under my, specialty of internal medicine. We have the rheumatologists. They handle all your joint issues and people with a lot of sort of what we call autoimmune conditions, all under the field of internal medicine, rheumatology. We also have the nephrologists or the kidney doctors. They are sort of responsible for taking care of you when your kidney is not doing well, especially when people have to go on dialysis because they are not able to make urine and things like that. So the nephrology team is also under my specialty. We have endocrinology. They take care of all your hormones and things like diabetes and all that, also still under my field. And we have what we call the infectious disease. So when it comes to, all the Ebola, coronavirus, all the common bacteria and viruses that you can think of, we are sort of the doctors who handle all that. So that also falls under my field. So it's a very broad specialty, and the list goes on and on.
Wow. So just to clarify, the internal medicine, is it the same as general medicine, or is it the same as, there's another word? It's the same or it's different?
So most of the time people confuse internal medicine and family medicine, or like the family practitioners, and
Yeah.
So, the difference is that the internal medicine doctors, more or less, they go more into the details of the acute management and acute care of the patient whilst you are in the hospital. If you see all these details that I've mentioned. And then we have the family physicians. The family physicians sort of are more trained to handle the preventive aspects of the health of the patient. So if you go to the clinic, you will see your outpatient physician. Most of them are family physicians. They are more trained to handle that. Internal medicine doctors also handle some of the follow-up in the outpatient as well. Just like you can go to the outpatient, you meet your cardiologist, endocrinologist, nephrologist, or you can even meet a primary care doctor there who also will be an internal medicine doctor, just because he or she may prefer working in the outpatient setting. So that is the sort of difference. And another difference too is that the family physicians, or the family medicine doctors, they also do other aspects like pediatric or the child care, and they also do OB-GYN, as well. So just picture it like when the family doctor comes to you in your home, it doesn't matter whether you are an adult, you're a child, you're a male, or you're a female, they are supposed to be able to take care of you in that field. And when something, is beyond them, then they will refer you to the specialists who happen to fall under the internal medicine specialty.
Oh, okay, thanks for the clarification.
You're welcome.
Thank you so much. I think most of us really go see our primary doctor, and we don't want them to say we're going to see a specialist. Because the minute they say we're going to see a specialist, our heart just drop into our stomach like, oh no, I'm really sick. So, but I think it's important to know that those specialists have a purpose. And so if you're going to see them, you have a specific thing that they want to follow. And I love the fact that you said holistic approach. So you know how when people are finding their major or when people are going to school, most time people think about medicine like, oh, this person is good in biology. That is why they are going to medicine. Will you tell us what are some of the subjects that, people, young people who want to go to medicine, what are some advice you want to give them when they come to pursuing their goal or pursuing their career?
So I really want to encourage them. Some people think that the medical field or medicine is left for the select few, but that is not really true. I'm an epitome of an example, who rose up from a very, less privileged community, and sort of went all the way, to this level. So I will say that whatever ambition, anybody has for entering into the medical field, just go ahead, pursue it. I know it may take some time. I remember when I started, people were telling me, are you willing to commit about 8 years of your life just training and studying when your colleagues will just finish 4 years of college and start working? And I'm like, okay, that is my passion. That is what I want to do. So if that is your passion, don't be moved. Just press towards it. The end result is very motivating. It's a prestigious profession, and all that comes with it is really very commendable. So I will encourage anybody who wants to go into it to just work at it and go into it. Don't be afraid.
Thank you so much, Doc. So one of the things I see most people talk about is, when you are young, people, encourage you. But is it a way that you can say, okay, I'm 25, I want to go to medical school. Is 25 too old? Is 30 too old? What will you encourage people who feel like they're middle of their life, or they have been waiting, they have been working so hard, it has been discouraging, but they are right here and they want to try? Do you think they should, or do you think at a certain age you should just give up on that dream?
So that is really a good question. I would say that I have met people who were even over 50 who were still interviewing during our residency interview period. And I would say that there is no age limit, to whatever you want to do. And for that matter, for the medical field, there is no age limit. So if you feel that that is a passion that, you want to pursue, I would just encourage you that don't worry about the age. In as much as you are willing to commit yourself to study and to push yourself to go through those years, you will be done. And once you are done, you will really, sort of know that it really pays off. The job satisfaction, the fact that you are taking care of sick people and they getting well, and the appreciation that you even have from families and patients, and that in itself gives you joy. So if that is your passion, just go in for it. A lot of people sort of say that, oh, I'm afraid of blood, I don't like blood. When you get into the field and you see that you are helping somebody to get well, you sort of your desire and passion will go beyond that dislike of blood, so to put it. So just work at it, never give up, don't let age press you, it's just a number.
Thank you so much. David, do you have a question to ask our guest?
Yeah. So would you say this is the best career for you? If you had the opportunity again, will you do this all over? We're asking because of all that is going on. What do you think and why? Will you do it all over again or will you not, and why?
Good question. So I will do it all over again if I happen to, sort of reincarnate, come back and choose. I still believe I'm going to choose to be a doctor. And even though we have all this COVID-19 infection going on and people are afraid, at times what I ask myself is that we go into patients' room, we take care of them, we do it with passion, we do it with joy. We are protecting ourselves in the best of our abilities. But a question that I've been asking myself, in this season is that I see, God's divine protection for healthcare workers and doctors is, very supreme. I mean, I know we do get the infection, we do get exposed, we do, go through a whole lot of things, but definitely our passion sort of trumps, all these occurrences that come, with the profession. Every profession, every career has its own sort of challenges that, it throws at you. It throws a very big ball at you, and you just have to stand, let it bounce back, and sort of you face it. Once that is your passion, you never, let go easily. So I would have, I would choose it again if I have the option to choose again.
Thank you so much. And I think one of the things I also want to ask, in terms of the medical school, one of the things that I know is that especially if you are here and you want to go to medical school in Ghana, do you have a way that you can educate our public? Because sometimes this is moment of truth. You are here and it's so competitive to get into the medical school here. Some people go to out of the state, out of country to go to medical school. Will you encourage Ghanaians who want to go to Ghana to go to medical school? Will you encourage that?
Great question. So first things first. So if you want to, if you are here, you want to go to med school. First, as you have to get you have to complete your 4 years of pre-med, which is the 4 years undergrad, and with that, achieve a very good grade point, and that means 3.5 to 4. It doesn't really matter what type of course that you pursue here. But at the end of the day, you will also write an what we call the MCAT. And now it continues to change. And so we have several components to it now. But that one also you have to do well. Okay, so those are your steps. So work at it first of all, try to get it in here in US, okay? So you do your undergrad pre-med, do well, write your MCAT, also do well. And with that, you also sort of beef up your CV with things like volunteering. If your parents still go to Ghana, you can go with them, whether you are doing some volunteering activities, all those things, sort of make your CV look good. If you want to take some teaching, activities also to boost it, sort of boost it up is good enough, okay? And then you can also sort of, if you want to do some attachment at some hospitals, whether you're a scribe, whether you want to do some research whilst you are having your 4 years undergrad, it also helps sort of make your CV look good. And then with all this, you apply to medical schools here in the States. And, I know it's competitive. Medical school everywhere, whether here, Ghana, or where else, is so very competitive. So you try to get in. If you try multiple times and you are not able to get in here, obviously I will strongly. So my answer to your question is that I will strongly encourage, if that is still your passion to be a doctor, don't let the system limit you. You can decide to go outside, okay? So going outside means that if you want to go to Ghana, I mean, I have a lot of friends who were born and raised here who, came to Ghana, to join us in a medical school. And then afterwards, they are, they came back here and they are still working, okay, as doctors. So that also helps. If you have to go to, the Caribbean schools, that's also good enough, okay? The focus is getting all your medical degree and learning what is expected of you. And at the end of the day, your knowledge base is not cut short. I trained in Ghana, came over here, did my postdoc at Harvard, move on now at Howard, internal medicine program, and I'm serving as a chief resident. Okay, we have graduate from U.S. medical schools, graduate from all over, the world. That, because I apply myself very well, so it doesn't matter. It all depends on. It doesn't matter where you train. It doesn't matter if you go to Harvard, you go to Yale, you go to my medical school in Ghana, you go to wherever. All that matters how you apply yourself. We are learning the same medical books. We are all seeing patients. And at times, I will even say that some of the training outside of the States will give you more exposure in terms of clinical findings and clinical examination, as opposed to some of the exposure that you may have in a more developed society. One thing though that I want to say is that if you train outside of the States, one disadvantage that it gives you is that you'll find it very difficult to go into the most competitive medical fields. So those fields are competitive not because they are better than other fields, but because we have less spots, less spots for resident physicians. Spots like, fields like dermatology, neurosurgery and things like that. We have very few spots here. So preferentially, they would like to offer those spots to American grad, as opposed to offering that to an international sort of medical graduate. So that is the only sort of limitation. But if you are not thinking about going into subspecialties that are having less spots, then really it doesn't really matter where you train. Once you train outside, you do very well in the licensing exam, and you will definitely go through the process, and you definitely will get a spot.
Awesome.
Thank you so
I have
much.
a follow-up.
I think that is important information that our viewers need to know. So this is moment or two. We're talking about career. And our doctor has really been nice, really laying out some of the, not only the challenges, but the determination, because it takes a lot to be able to focus on where you want to go. And he is telling us, don't give up. There will be stumbling blocks along the way, but, if that is your dream and that is your desire, God will always make a way. So thank you so much. I really appreciate that insight. David, do you have a follow-on question?
Yes, I do. So about going to medical school. When I was in Ghana, the myth or maybe the assumption was that you needed a science background to go into medicine. So if you had an art background, it's like you cannot apply to the medical school. You need a science background. Is that still the case? Or is that the case at all? And then also, I'd like you to take us through a typical day. How does a typical day for you look like?
Okay, great. 2 questions here. So, so as I said earlier, if you are training here, then really, the science background really doesn't really come to play, because when you are writing your MCAT and all that, they're going to ask you organic chemistry phases and all those. Biology and all those questions, calculus and all those things will sort of come into play. So people who do the science sort of courses have an upper hand in doing well in those MCAT and subsequently sort of bettering their chances of getting into medical school. But in Ghana, we don't write the MCAT. So in Ghana, how it's been happening is that when you go to the high school and you pursue the science, science degree or the science courses, then from that is when you can, get to med school. If you go on to pursue like the general arts and things like that, then agriculture and things like that, then you will not, have the chance to go to med school. So it's very important you pursue the science courses if you are pursuing, medical school pathway in Ghana.
Oh, okay.
But if you are here, really, it doesn't matter what you do for your undergrad.
You just need to pass your MCAT, which is science-based.
Yes, exactly. It's science-based. So if you do your undergrad in science-based, areas, then definitely it will give you an upper hand when you're studying for your MCAT. But still, they have several like courses, Kaplan courses, and things like that you can, even though if you don't do the science subjects in your undergrad, you can still do, courses like Kaplan courses to help you master the materials for the MCAT and still do well.
Okay.
Thank you. Thank you for that information. So I know she has a second question. What is a typical day like?
The typical day like. Yes. Okay. So typical day like in the hospital or typical day like what?
Yes. When you go to work or you go, right now you are a chief resident. So when you go, what is it like in a typical, what does it look like?
Great. So as resident physicians, we, typically our day start quite early. Most of the times from 7 a.m., we go in to take sign out from our night colleagues. And depending on what rotation you're doing, if you're in the intensive care unit, then you'll be taking care of patients who are critically ill, who have been, who are on ventilators, who may need like procedures, whether like we need to put in like a line in your neck, sort of to help to give you, some medications, or whether we have to put in a tube in your chest to drain some fluid from there, or fluid from your belly or things like that. So that sort of will continue. We will round on our patients. We see our patients, examine our patients, check how they did overnight. Be also able to communicate with our nursing team to see how the patients are doing, how they are tolerating their medications, and sort of following up with patients' families as well, and coordinating the care of the patient with other subspecialties that are involved in the management of the patient, and speaking with other allied health teams like the physical therapy and all that, the nutritionist, everything. If you are doing a rotation on the floor, it sort of goes along the same path, but that may not be a lot of critical sort of procedures. Most of the patients, they may be acutely sick, but they are not critical. So sort of the level of expertise goes down there a little bit. And I mean, it may also be like a consult service that we may be on. It could be like infectious disease, especially in these times of COVID. A lot of the patients, may have the disease, and a whole lot of other conditions may be going on that they may employ the services of other subspecialties. So it really depends on what rotation we having at that time or day, but typically it goes on up to anywhere 5, 7 p.m. If you are having late admissions, even though you are supposed to be signing out around, let's say, 5 p.m. or 7 p.m., but if you have a late admission and the patient has come in because of your love and care for the patient, you cannot just leave the patient and sort of, say that, no, my time is up, I'm going. Yeah, we still have to stay and take care of the patient, make sure that the patient is stable until, the next team of doctors come to take over from us. So that's how really it goes.
Thank you
Awesome.
so much. One of my other questions that I want to ask, I know you are very passionate about your career field, but within internal medicine, do you see a subspecialty that you want to go to, or you are okay where you are and you don't see yourself branching to another area or focusing on another area in the near future?
Good question. I always answer this question in two ways. So one way is to say that I don't, want to do anything. And one way is also to say that because I like all of them, I really find it very difficult to choose which one. So usually people say that sort of you become a professor of like a hand, and sort of all your attention is directed to the hand. And when something is happening with the head, even though you're a doctor, it's like you are still refusing to sort of know what is going on with the head. So what I want to say from that is that I like to do all. And for that matter, I like to go into what we call the hospitalist, medicine. And that means the kind of doctor or the kind of internal medicine doctor that will be taking care of patients when they are acutely sick in the hospital and they have been admitted, they've gone through the ER, and the ER physician think that, no, this patient cannot go home and needs to be on, on admission. I will be the kind of doctor who will be taking care of that patient. Whether, at some places, some hospitals too, the hospitalist physician will also be responsible for seeing patients that are critically ill who are in the intensive care unit, which I also like to do. And with that, sort of, it ties in all the various subspecialties, in internal medicine. They'll be having severe infections, so infectious disease, I'll be handling that. They will be having, heart problems, I'll be handling that. And, I'm also keen in doing procedures, with when my patients need them. So for now, I will want to do the hospitalist track. And as time goes by, sort of add more administrative, medicine also to it. So that is my career path. I don't want to isolate myself to a single system of the body. I want to do everything.
Wow.
Wow, that is awesome. Thank you so much. And being in the medical field, I think one of the things I'm always very cautious of or very concerned about is when a doctor is always focusing on a subspecialty. So then I feel like that doctor is not giving my holistic care. So I'm glad to see that you like the holistic approach, but not just specific areas. So thank you so much. That is encouraging. I know it's a lot more overwhelming, but I personally, I'm really grateful for that. So thank you.
Certainly. Yeah.
So, David, do you have a question to ask our
Yeah. So, what should people consider when choosing a career in general? Like, what should people consider when choosing a career?
Great question there, Davi. So, number one, I would say they should look for a career that they see, they will see themselves doing for the rest of their lives. It's very, very important. If you don't see yourself, taking care of sick people and being in the position to always sort of update yourself, read to know all the changing trend of things. Like now for medicine, I mean, we have COVID-19 that came up fresh, all of us, including healthcare workers and non-healthcare workers, all of us did not know about this, COVID-19 is a new thing to us. So, I mean, you should be, as a health, provider, you should be in the position to continuously, learn and upgrade yourself. So if you don't find yourself, or you don't see yourself doing this for the rest of your life, then it wouldn't be, an appealing sort of specialty for you. So number one, you must really like that profession for the long term. I will also say that, I mean, you also have to look at the job stability of that profession that you want to go into, right? So for me now, I just mentioned I'm moving towards the hospitalist track. So if they say they are laying people off, okay, and they are laying people off from the outpatient, I'm acutely taking care of acutely sick persons who are on admission. I will never be laid off. So it's very important you look at the job stability around the profession that you want to the career that you want to go into. And you also want to look at things that will give you the sort of the joy, the satisfaction that you need, and of course it may not necessarily have to do with money, but at least think about something that will be able to put food on your table, okay? Something that you will not have to go about sort of begging and borrowing and having a whole lot of debt all the time on you. So it's also something that you have to, look at, be able to take care of yourself, take care of your family, and, things like that. So I would say in summary, like what you want to go in for, whatever you want to do for the rest of your life, must have a very good job stability, and then also you must really love doing it.
Thank you.
Thank you. That is good. I like the fact that you say you must love doing it. If you wake up in the morning, you're going to work and you hate it, then this is the time for you to change your career path and find something that you really love to do. Because if you love doing something, when you wake up in the morning, you are going to work, you don't feel it as a work. You feel it as your passion. You have driven to really give it your all. So that is really important. So, Dr. Jan, I think one of the things that most people forget is that being in the medical field or being a doctor, what are some of the challenges that you see in our community when you are taking? Because I think our community, and I'm just talking from my standpoint, moment of truth, we don't tend to choose our own when we are choosing doctors. Do you think we need more education in choosing doctors that understand us culturally, ethically, our belief system, so that way they are the best person to take care of our needs?
That is a good one there as well. I mean, it's very important when choosing a doctor, I mean, to choose a doctor that you think sort of knows exactly what's going on with you. A doctor that will share, will be very empathetic towards your condition. A doctor who is not just in there because somebody convinced him to pursue that path. So yeah, so it's really important, because I've seen a lot of patients who sort of are confident sort of in sort of sharing the details of what they are going through with one doctor, and they are not able to open up to another doctor. So the goal is to have you have a very good, healthy sort of lifestyle for you. So if you are not able to communicate very well with your doctor, if you are not able to have a very good rapport with your doctor, then I mean, how will you be able to open up to the person, for the person to help you? If the person may not necessarily share in your belief system, but at least they should have sort of respect for your belief system that you practice as well. And I mean, it's also important to have doctors who sort of have had some form of experience also in your sort of your cultural beliefs. And even if they have not had that experience, if you're able to sort of speak with them, if they are open up, you speak with them, some of your cultural beliefs, some people believe that they need to take concussion before they go to sleep, just to prevent headache. And if the person is willing to listen to you as a patient, they will be able to give you the appropriate medical advice, and that will sort of help you to change some of the supposed bad practices that you as a patient may be having. And by so doing, it sort of helps you towards a better health achievement. So it's very important. You must have a doctor that you'll be able to open up to and share your information with without any fear.
Thank you so much. I really appreciate that, because I think most times, because of lack of knowledge, when we are choosing doctors, we don't put all the variables in place. And also, we end up giving the doctor not all the information they need, so they cannot better diagnose our situation. So it is important to feel comfortable with your doctor, so that way you are confident that the doctor is going to take care of you. So thank you so much. So in your practice, if you have to give some last minute advice to our community in terms of COVID-19, in terms of health, in terms of prevention, what are some of the things that you want to advise our community to help them taking better care of themselves?
Okay, at this time of the season and throughout the world, I mean, I know there is some form of panic out there because daily the number of COVID-19 infection cases, continue to go up, in the world. But what I want to say is that prevention is always better than cure. And for the case of COVID-19, we do not have the cure, in place yet. As we all know, we do not have any drug that sort of will treat you and take away the virus from your system. But at least what we have is the preventive measures. So at this point, COVID-19 kills. COVID-19 is, is real. So I would like to encourage everybody to, continue to practice social distancing. We should also continue to wear appropriate face masks, regular hand washing, sanitization, of our hands. And I mean, if you don't really have business going out to, some of the public places, I mean, it's better you stay at home. because staying at home, I mean, is a preventive tool from you getting into contact with people who have the virus. The more you go out, the more, you are at risk. I know that certain states, are loosening up, some of these measures, but still the mitigation, measures are not completely in place, and there still remains some form of risk of contracting this virus. So we should be very vigilant, practice social distancing. Somebody is coughing, obvious coughing and sneezing, try to, be away from that person and wear your mask.
Thank you so much, Doc. I really appreciate that. Do you have some, as we're trying to wrap up, because we can go on and on, but I just want to say, if you have some last minute, or do you even have some last minute advice for, in terms of career and also your shout out?
Okay, great. I mean, it's always good to dream big. I mean, to the youth and the young, adults out there, and even to the elderly. As I said, I met people even in their 50s, apples who were still interviewing in the medical field. I would say that dream big. Don't look down on your potential. There are a whole lot of things that you can do and a whole lot of opportunities that we have available in this country and elsewhere as well. Just tap into those opportunities. If there is a career path that you see captivating for you, just research on that. Get to talk to people in that field. Let them tell you what they did to be successful, and get to learn the path, towards attaining that profession in that field. Don't think that it's difficult and so you cannot do it. Everything that you set your eyes on doing, I just want to assure you that with God in the equation, you will definitely be able to do it. That is something that, always my family, my wife tells me. She always sees me as somebody who wants to achieve and go on and achieve towards whatever that you want to, achieve. So whatever you want to do, just press on it. Don't give up, and you will definitely be able to achieve it.
Thank you so much, Doctor. I really appreciate that. David, do you have some last minute question you want to ask our doctor?
No, that'll be it for today. Okay. I have shout outs though.
Okay, please go ahead.
Our 2020 graduates. On the note of our doctor telling you to apply yourself and go for it, I'm going to congratulate our 2020 graduates. We want you to know that we celebrate you, and you need to celebrate yourself too. This is a time when you not find people on the stage clapping for you while you walk to take your diplomas and all of that. But you should be able to appreciate yourself, clap for yourself, celebrate yourself. Just know that we are all celebrating you, but we are all indoors and we can come out there and celebrate you. So know that you've done a great job. It's been a trying season, but you've been able to achieve. If you are graduating right now, it's because you've been able to meet the criteria. So we congratulate you as well. Also to May Bonds, all those born in May. Yay. Congratulations. Our co-host is in May. Na is in May. Now who else is in May?
Doctor,
I think Elder Tip is in May too.
No, Doctor is in May.
Yeah.
Oh, in May as well. Oh, okay. Hi, May Bonds.
Yes, and there's more birthdays too coming up. My sister's birthday is tomorrow, so yes, a lot of May birthdays.
Okay. I think May is a good time.
It is.
Yeah, next year by May we'll be seeing a lot more due to the COVID, I think. So lockdown, some more lockdown babies too. El Shaddai International Market. Thank you very much. Please go to El Shaddai International Market for all your grocery needs. Ashon Collection. Thanks to Ashon Collections for sponsoring Moments of Truth. Thanks to Delatech. Thanks to Comfort Realty. Thanks to Lean on Jesus Foundation. And of course, our technical team that helps us to come to you. Even though there's COVID and there's lockdown, we are still able to come online. It's because of our technical team and how much they are willing to sacrifice in order for everything to keep going. So God bless you all. We thank you for hanging out with us. Remember, we are on air live on Tuesdays from 7 to 8 and on Thursdays from 7 to 8. So Empowerment Hour is on Tuesdays and Moment of Truth is on Thursdays. Over to you, Na.
Yes, and I also want to say that our Church of Pentecost is having Internal Mission Week. So anywhere you are, please tap in your local and make sure that you are already on so that way you hear the good news. And just really be encouraged that even though we are locked in, God is still God and we're still sharing the good news. So please be connected. And of course, Maryland District is having the graduation ceremony for our 2020 graduate on Zoom. So please reach out to your local leaders and make sure that you get connected. We want people to feel like, yes, even though we are locked down, we are not locked away from each other. We are connected. And we want to thank our leadership. We want to thank our national head apostle, Marco, our regional head apostle, Semno, and of course our district pastor, Pastor Evans Boateng, for all that they do to make sure that we feel connected and really feel that God love is what we need. So until next week, thank you so much to our guests. We really appreciate all your hard work. Thank you so
too.
much.
Thank you. It's been a pleasure being on this show as well. Thank you.
Thank you. Until next week.
Bye for now.
Bye.
Bye.
The American dream of owning your own house is a reality now.
Comfort Realty will represent you in selling, leasing, purchasing commercial property or residential in DMV area. Count on our ability to offer the best in the market. DMV, your American